Good morning, everybody. Today is my last clinical day of the semester, so I wanted to take you along with me because I'm actually doing really interesting cases. I'm doing lung cases today, so I wanted to explain to you guys what we do for lung cases anesthesia-wise and how those go, because you seemed to like my last video where I explained laparotomies, so I'm going to do the same thing for this video and explain everything we use and what we do. It is about 6 a.m. I'm about to head inside and start getting set up. I'm super excited to do these cases, and I'm super excited to be on winter break after today. I'm also going to take you through my whole day, so stay tuned and I'll catch up with you inside. Quick little update. We just finished our first case and it went very well. It's almost 10 a.m. and we're going to get set up for our second case now. So that's going to take just a few minutes and then we'll get going with that. These cases are usually relatively fast, so we'll be able to do a bunch today. I think we have 4 scheduled and we'll probably get them all done before I leave at 3. I like these kinds of days where we have fast turnover because it keeps the day going and you get a lot done. But overall, I like lung cases. These are very interesting, very technical. There's a lot of skills involved, so it's been going great. I will catch up with you on my next break because I don't have a lot of time to talk since it takes a while to set up, and yeah, bye. Okay, just got home and it's been a few hours since I last talked to you, but I wanted to tell you about the rest of my day and about lung surgeries, and also we are currently packing because we leave today for a trip. Very special trip to Puerto Rico. So I'm going to take you along for that too. We're leaving to go to Columbus today where we fly out from. One second, let me mount the camera. Today I ended up doing 3 cases. They were VATS, which is video assisted thoracoscopy surgery. That's always a tongue twister for me. And what that is basically a lung procedure done with video cameras, and they're inserted through small incisions instead of opening up the whole chest. And a variety of things can be done with those: biopsies, diagnostics, and also they can do removal of tumors or something like that through that as well. Sometimes those end up converting to open surgery if the area is too big or they aren't able to access where they need through that, so we're always prepared for an open surgery too. With these cases, we do a general anesthetic. We use an arterial line for blood pressure monitoring and also for drawing ABGs. We draw ABGs periodically throughout these cases because we do 1 lung ventilation, which is the coolest thing about this case. We intubate the patients with what we call a double lumen ET tube, so we're able to ventilate or inflate 1 lung at a time. So what we do is we deflate the lung that the surgeon is working on and we ventilate the other lung. This tube has a tracheal and bronchial side, and what we do is inflate or deflate whichever cuff correlates with the lung that we want to inflate or deflate. After the tube is placed, we check with a fiber optic scope. That's where we check the tube placement. So we need to go in and make sure that the bronchial cuff is in the right spot. It's not too deep or too shallow, because if it's too deep or too shallow, you'll have problems. We have to keep the patients relaxed during these cases, so we use long-acting muscle relaxant, and we also get 2 IV sites because there's a vascular area around the lungs, and we need to make sure that we're able to give blood or fluids if we need to, if there's any complications or we have to convert into an open. We don't typically do a central line because that's not usually necessary. Some of the main complications, we'll see this from an anesthesia perspective, is just inability to oxygenate or eliminate carbon dioxide with the 1 lung ventilation. So how we can solve that is by adding CPAP to the lung that is down. So without actually all the way inflating it, we use this bag that applies a certain amount of CPAP, or positive pressure, into the lung. And if that doesn't work, we're having a lot of trouble, we need to tell the surgeon so that they can take a break and we can ventilate both lungs if we're in a position where we're able to do that during the surgery. Like I said, we monitor ABGs very carefully during the surgery to make sure the patient's not getting acidotic or their CO2 is not rising or they're not dropping their oxygen saturation. So there's just some things we need to pay attention to. There's not any special medications that we give during this case per se, and it's similar to another general anesthetic, just with a different tube and more considerations about the lungs and ventilation and all that stuff. So yeah, pretty interesting. I really like these cases. And that's about it for lung cases. So I hope you found that informative, and I'll keep doing this with cases that I do so that I can involve you guys more, because I obviously can't talk about patient specific information, but I can talk about case specific information because that's just general information. And now I'm off to finish packing because we're leaving this afternoon, and we also need to bring Beamer to the dog sitter. And that's about it for now. I'm super excited. I'm ready to go to the beach, and I'll catch up with you soon. We just dropped Beamer off, and he didn't even care that we were leaving. We were really glad because we were nervous to leave him because we feel like he's attached to us, but he just ran in there and started playing with our dog sitter's dog and running around, didn't care at all. So it was perfect. Now we are actually at a house that just got finished, and John's shooting some footage of it, and we're gonna make a video so that we can post it on Facebook and then see if anybody's interested in buying it. I'll show you some footage of this really quick so you can see what the house looks like, because I think it came out really pretty. We're on the road. It was a little hectic trying to get ready to leave and everything on time because we were rushing around, but Beamer loves the dog sitter. Just an update, she sent us some pictures. I'll insert here so you can see how cute he is and how much fun he's having. But yes, now we're on the road. We should be in Columbus in about an hour and a half, and that's it. This road is like really loud, so I'm not going to talk too much right now, but I'll catch up with you when we get there. We made it to our hotel in Columbus. What were you doing next to me?
I'm gonna do this the whole.
We had a few stops. So we stopped at Destination Donuts, which has vegan donuts in Columbus, and they were almost out of everything, but they had 2 kinds left, so we got to try those. And then we tried Blaze Pizza because John had to try it since LeBron James owns part of it.
Yes.
So we tried that, and it was actually really good and really reasonably priced. So that's what we have done in Columbus so far, and now we're at the hotel. It is like 10 o'clock at night, and our flight is at 6 a.m., so we have to get up super early tomorrow. So we're going to call it a night and go to bed and just get ready for our trip. I will be vlogging in Puerto Rico. We're leaving in the morning, so I will start that vlog tomorrow. So stay tuned next week to see what we do in Puerto Rico. Right?
Well, I was in this one. I didn't get a very big speaking part.
You go ahead. Go ahead.
I'm over it. You didn't tell them that we drove all over Columbus looking for boba tea,
No, I
and
didn't
nobody
tell them
has
that.
coconut milk.
Oh, yeah. That was really weird. Also, sorry, I just spoke the whole time with John sitting next to me quietly.
Yeah, you act like this is your vlog.
Well, I just put you here so they could look at your handsome face.
Oh, thank you so much, babe.
Yeah. Okay. See you guys next week.